Malnutrition, causes and consequences. Key points. Malnutrition is a not unusual place, beneath identified, and undertreated situation in health center sufferers. Disease-associated malnutrition arises because of decreased nutritional consumption, malabsorption, improved nutrient losses, or altered metabolic demands. Wide-ranging modifications in physiological characteristic arise in malnourished sufferers mean to improved fees of morbidity and mortality. Routine dietary screening must be undertaken in all sufferers admitted to the health center. The use of a demonstrated device including the Malnutrition Universal Screening Tool. Healthcare expenses are extensively improved in malnourished sufferers. The term malnutrition has no universal definition. It has been used to explain a deficiency, excess, or imbalance of an extensive variety of nutrients, ensuing in a measurable unfavorable impact on frame composition, characteristic, and scientific outcome. Although malnourished people may be beneath or overnourished, malnutrition is frequently used synonymously with undernutrition. The length of the hassle. Malnutrition is a not unusual place, beneath identified, and undertreated hassle dealing with sufferers and clinicians. It is each a reason and effect of disorder and exists in institutional care and the community. Approximately 5% of the United Kingdom populace are underweight with a frame mass index, BMI, under 20 kg/m, despite the fact that overweight those who accidentally shed pounds and sooner or later have a BMI in the regular variety also are vulnerable to malnutrition. Other sufferers end up at threat due to an acute event, e.g. small bowel infarction, leaving them not able to satisfy their metabolic necessities each with inside the brief and longer term. The occurrence of malnutrition will increase with the aid of using at the least twofold with inside the aged and people with continual disorder, and threefold in people residing in institutional care. The occurrence of malnutrition in UK hospitals mentioned during the last 15 years stages from 13–40%, with many sufferers seeing a similarly decline of their dietary popularity in the course of health center admission. A massive survey performed with the aid of using the British Association of Parenteral and Enteral Nutrition, BAPN, in 2008 discovered that 28% of inpatients have been vulnerable to malnutrition. The occurrence became better in unique subpopulations, for example, 34% of all emergency admissions and 52% of admissions from care homes. Specific micronutrient deficiencies also are not unusual place, particularly with inside the aged. For example, folate deficiency has been defined in 29% of the impartial aged populace and 35% of these in institutional care. Causes of malnutrition. Malnutrition in evolved nations is sadly nonetheless greater not unusual place in conditions of poverty, social isolation, and substance misuse. However, maximum person malnutrition is related to disorder and can get up because of 1. Decreased nutritional consumption. 2. Decreased absorption of macro and/or micronutrients. 3. Improved losses or altered necessities. 4. Improved strength expenditure, in unique disorder processes. Dietary consumption. Probably the unmarried maximum vital etiological thing in disorder-associated malnutrition is decreased nutritional consumption. This is idea to arise because of discounts in urge for food sensation due to modifications in cytokines, glucocorticoids, insulin, and insulin-like increase factors. The hassle can be compounded in health center sufferers with the aid of using failure to offer everyday nutritious food in surroundings wherein they're covered from habitual scientific activities, and wherein they're provided assist and help with feeding whilst required. Malabsorption. For sufferers with intestinal failure and people present process belly surgical procedures, malabsorption represents an impartial threat thing for weight reduction and malnutrition. Increased losses or altered necessities in a few circumstances, including enterocutaneous fistulae or burns. Sufferers may also have immoderate and/or unique nutrient losses, their dietary necessities are commonly very specific from regular metabolism. Energy expenditure. It became idea for decades that improved strength expenditure became predominantly chargeable for disorder-associated malnutrition. There is now clean proof that during many disorder states overall strength expenditure is in reality much less than in regular fitness. The basal hypermetabolism of disorder is offset with the aid of using a discount in bodily activity, with research in in-depth care sufferers demonstrating that strength expenditure is commonly under 2,000 kilocalories/day. The exception is sufferers with foremost trauma, head injury, or burns wherein strength expenditure can be drastically better, despite the fact that most effective for a brief time frame. Consequences of malnutrition. Malnutrition influences the characteristic and healing of each organ system. Muscle characteristic. Weight loss because of depletion of fats and muscle groups, along with organ mass, is frequently the maximum apparent signal of malnutrition. Muscle characteristic declines earlier than modifications in muscle groups arise, suggesting that altered nutrient consumption has a vital effect impartial of the outcomes on muscle groups. Similarly, enhancements in muscle characteristic with vitamins help arise greater unexpectedly than may be accounted for with the aid of using the alternative of muscle groups alone. Downregulation of strength-based cell membrane pumping, or reductive adaptation, is one cause of those findings. This may also arise following most effective a brief duration of starvation. If, however, nutritional consumption is inadequate to satisfy necessities over a greater extended time frame, the frame attracts on practical reserves in tissues including muscle, adipose tissue, and bone main to modifications in frame composition. With time, there are direct outcomes for tissue characteristic, main to lack of practical capability and a brittle, however stable, metabolic state. Rapid decompensation takes place with insults including contamination and trauma. Importantly, unbalanced or unexpected immoderate will increase in strength consumption. Additionally, placed malnourished sufferers vulnerable to decompensation and refeeding syndrome. Cardio-breathing characteristic. Reduction in cardiac muscle groups is identified in malnourished people. The ensuing lower in cardiac output has a corresponding effect on renal characteristic with the aid of using decreasing renal perfusion and glomerular filtration charge. Micronutrient and electrolyte deficiencies, e.g. thiamine, may additionally have an effect on cardiac characteristic, mainly in the course of refeeding. Poor diaphragmatic and breathing muscle characteristic reduces cough stress and expectoration of secretions, delaying healing from breathing tract infections. Gastrointestinal characteristic. Adequate vitamins is vital for retaining GI characteristic. Continual malnutrition effects in modifications in pancreatic exocrine characteristic, intestinal blood flow, villus architecture, and intestinal permeability. The colon loses its potential to reabsorb water and electrolytes, and secretion of ions and fluid takes place inside the small and massive bowel. This may also bring about diarrhea, that is related to an excessive mortality charge in seriously malnourished sufferers. Immunity and wound recuperation. Immune characteristic is likewise affected, growing the threat of contamination because of impaired cell-mediated immunity and cytokine, complement, and phagocyte characteristic. Delayed wound recuperation is likewise nicely defined in malnourished surgical sufferers. Psychosocial outcomes. In addition to those bodily outcomes, malnutrition additionally affects in psychosocial outcomes including apathy, depression, anxiety, and self-neglect. Malnutrition, scientific outcome, and the fitness economy. Clinical outcome. The outcomes of malnutrition on physiological characteristic have a vital effect on scientific results. In the 30s, surgeons determined that sufferers who have been starved or underweight had a better prevalence of postoperative headaches and mortality. A massive wide variety of research have sooner or later supported this authentic observation. Malnourished surgical sufferers have hardship and mortality fees 3 to 4 instances better than generally nourished sufferers, with longer health center admissions, incurring as much as 50% extra expenses. Similar findings have additionally been defined in scientific sufferers, mainly the aged. It is frequently tough to split the deleterious outcomes of malnutrition from the underlying disorder method itself, particularly due to the fact every may be a reason and/or effect of the other. However, there may be clean proof that vitamins help extensively improves results in those sufferers. It is, therefore, crucial that malnutrition is recognized via the screening. The value. Malnutrition is likewise a main useful resource difficulty for public expenditure. BaPN has these days calculated that the expenses related to disorder-associated malnutrition inside the UK in 2007 have been over £13 billion, extra than that for obesity. This calculation worried the summing of remedy expenses for each the underlying disorder method and malnutrition. The potential value financial savings related to prevention and remedy of malnutrition are considerable. A saving as small as 1% represents £130 million in line with year. There is proof that for unique conditions treating malnutrition produces value financial savings of 10 to 20% or greater. Assessment of dietary popularity. Identification of sufferers vulnerable to malnutrition at an early level of health center admission, or attendance to the outpatient clinic, permits for early intervention with dietary therapy. The Malnutrition Universal Screening Tool, MUST. MUST is a easy, rapid, and smooth technique to display sufferers and has been confirmed to be dependable and valid. It ambitions to perceive the ones at threat with the aid of using incorporating 1. Current weight, BMI. 2. History of new unintended weight reduction. 3. Likelihood of destiny weight reduction. Figure 1 affords a manual for the use of MUST. The general MUST rating is a higher predictor of final results than ratings from the person components. Malnutrition Universal Screening Tool, MUST, for adults. A report by the Malnutrition Advisory Group of the British Association for Parenteral and Enteral Nutrition, 2003. Screening. The screening method identifies sufferers who require a greater special evaluation and components of an individualized stepwise control plan with the aid of using a vitamins specialist. In vulnerable affected person companies, the easy provision of everyday food or meals with higher dietary content material can be sufficient to deal with dietary threat. Additional measures may also consist of broader menu selections or helping with feeding. Patients in whom those social interventions are inadequate to make certain that dietary necessities are met want the addition of oral dietary supplements or enteral tube feeding beneath dietetic supervision. Patients not often require parenteral vitamins, PN. Need for PN commonly takes place inside the context of an inaccessible or non-functioning GI tract. Rescreening of inpatients at 7-day periods in the course of a health center admission signals clinicians to the ones who've misplaced weight and require extra intervention. Initiatives to enhance dietary care. Several courses from expert and affected person organizations, along with the Royal College of Physicians, have highlighted the issues related to malnutrition. Unfortunately, requirements of care in lots of establishments stay poor. Therefore, a collaboration among the Department of Health and stakeholders with an hobby and know-how in dietary care has posted the Nutrition Action Plan, which units out key priorities along with 1. Elevating awareness. 2. Making sure get right of entry to guidance. 3. Selling screening and training. 4. Clarifying requirements. The Care Quality Commission has recognized dietary care as one of the center requirements which all acute trusts are required to deliver. However, now no longer all offerings are inspected yearly and sufferers keep to die because of malnutrition. As a result, dietary care has been protected in a brand new regulatory framework brought in April 2010 for fitness and social care offerings, with a view to make certain that greater interest is centered on vitamins. At a nearby level, all hospitals must have a long-time multidisciplinary vitamins help group for dealing with sufferers with complicated dietary issues. Within every organization, there must additionally be a vitamins guidance committee to expand regulations for dietary care, which must be frequently audited as a part of scientific governance frameworks. Conclusions: malnutrition, that is frequently ignored with the aid of using clinicians, is not an unusual place and has extensive ranging outcomes on physiological characteristic. It is related to improved fees of morbidity and mortality in health center sufferers and extensively will increase healthcare expenses. Implementation of a easy screening device identifies sufferers at threat and permits suitable remedy to be instituted. This could extensively enhance scientific results and decrease healthcare expenditure. Every physician must apprehend that right dietary care is essential to appropriate scientific practice. By addressing deficiencies within the training of all healthcare experts and exerting have an effect on via scientific management, there may be real enhancements in dietary care.